Welcome to Speak Up and Stay Alive Radio with author, speaker, and your host, Pat Rouleau.
Serving you a generous helping of everything you need to know to help you and your loved ones stay safe during any doctor or hospital visit.
The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
Hello, I'm Pat Rouleau, and welcome to the best time of the week, the time when you and I get serious about our health and about staying safe during every healthcare or hospital encounter. As you know, I host an online radio station called Speak Up Talk Radio Network at speakuptalkradio.com. And we have about 50 programs right now that range from health-related to spiritual, metaphysical, intuitive, entrepreneurship, and so much more. Well, one of the hosts has become a fine friend, perhaps as we share similar thoughts when it comes to healthcare. He is a registered pharmacist and holistic practitioner who has offices in Wexford, Pennsylvania, and Peachtree City, Georgia. Don't you just love that name, Peachtree City? I want to go there. Anyway, he's been on the show as a guest about 6 months ago. And today he is back with us once again to talk about the increase in emergency room and hospital visits, and how this translates to the rise in secondary infections. So I'm looking forward to that, and I know you'll learn a few new things too. Plus, as usual, I have many more odds and ends to share with you. So let's get going, because right now, it's time for the healthcare hazard of the week. Are patient satisfaction surveys killing us? According to a recent article in the Washington Examiner titled, Obamacare program may be linked to emergency room opioid prescriptions. Now, opioids, weird sounding word, but they are medications that relieve pain. You'll know the names of some of these. Medications that fall within this class include hydrocodone, called vicodin, oxycodone, such as Oxycontin and Percocet, morphine, codeine, and other related drugs. Experts say too many patients are being prescribed opioid painkillers by emergency room doctors, and a program created by Obamacare could be enabling the problem. A new study released just last week found that 17% of nearly 20,000 patients were discharged from emergency rooms with an opioid prescription. Experts and lawmakers say a push under Obamacare for hospitals to get good patient satisfaction scores is one of the problems. America is in the midst of an opioid epidemic, according to the Centers for Disease Control and Prevention. Painkillers killed more than 16,000 people in 2013. A huge part of the problem is the prescribing of painkillers, which quadrupled from 1999 to 2013, and emergency room prescriptions are part of this trend. For instance, opioid addicts will sometimes injure themselves just to get access to a small amount of painkillers, and it can be hard to tell whether the patient is actually hurt or an opioid addict. A patient could get 90 Oxycontins from a primary doctor and arrive in the emergency room asking for painkillers a few days later. Patients with back pain got the most opioids, followed by those with abdominal pain. Oxycodone, the active ingredient in Oxycontin, was the most prescribed with 52%. Doctors may feel pressured by hospital administrators to prescribe opioids because it may lead to a better score on a patient satisfaction survey. The program created by Obamacare tied extra funding to high scores on the survey because their reimbursement and quality ratings are linked to the way patients rate them on the categories, including a category about pain. Several senators wrote to CMS last year saying that the surveys could impact opioid prescribing, and they cited reports of doctors in South Carolina admitting to prescribing more opioids in a response to patient survey scores. One hospital with low satisfaction scores even went so far as to offer vicodin goody bags to patients discharged from its emergency room in an effort to improve its scores. Because there is a push to give the patient what they want, which may not always be the standard of care. And apparently, yes, many people want opioids. In fact, and get this, America consumes 80% of the world opioid supply. And that's 99% of the world hydrocodone supply, but only has 5% of the world's population. Now, if you don't think America has some kind of an opioid problem, well, think again. Now, you combine this with the fact that in almost every single health plan in the United States, it's easier to get an MRI and back surgery than it is to get physical therapy. So there's a fine equation for you. More tests and stronger drugs equal more satisfied patients, and more satisfied patients equal, you got it, more pay. From an article titled "Why Rating Your Doctor is Bad for Your Health" in Forbes, they say, by creating a monetary incentive to increase patient satisfaction, the government is not only increasing its expenses, but promoting a metric that significantly increases death rates, says William P. Sullivan, an emergency room doctor in Spring Valley, Illinois. Another emergency room doctor in Columbia, South Carolina, who requested that we withhold his name, walked us through how this plays out in real life. Between 5% and 7% of his compensation, some $10,000, is dependent on high Press-Ganey scores. Now, Press-Ganey is the organization which administers the federal survey. So, when the family of an elderly woman insisted that she be admitted to the hospital after stroke-like symptoms, this doctor agreed to do so, even though her test results were negative and he wanted to send her home. The family refused, and they told me so, he recalls. Do I call security and escort them out? I was more concerned with them giving me a bad patient satisfaction survey score than her going home and having a stroke, which he considered highly unlikely. In admitting the patient, he exposed her to hospital-borne infections, and worse, a hefty bill for, as he puts it, us doing nothing since she did not satisfy the criteria for admission. Wow. Now, overtreatment is more than a silent killer. The article continues, it's cripplingly, interesting word, cripplingly expensive. Drill down to almost any procedure that keeps skittish patients happy, and the price tag is enormous. Overused prostate cancer screenings? At least $3 billion a year. Unnecessary antibiotics? Another $1 billion annually, with the added harm of creating drug-resistant bacteria. All told, overtreatment accounted for up to $226 billion in 2011 for things like unnecessary procedures and prescriptions that don't help patients. Another $55 billion a year is directly tied to the abuse of prescribed opiates. Kind of ironic, since government-mandated surveys were supposed to cut medical costs. Well, until the government got involved, surveying patients was a sleepy niche business. Then, in 2002, the Centers for Medicaid Services announced a national program to survey patients and require public reporting of the results. The move was part of a Bush administration initiative to improve accountability and public disclosure, and to empower patients to make more informed decisions about health care. Well, now, let's not even think about how inaccurate those survey results are, as most surveys are flawed by the fundamental principles of statistics. Plus, what does patient satisfaction have to do with good medical care? Perhaps what the patient wants is not good medicine. Response rates to these surveys have been dramatically declining over the past decade, says Paul Alexander Clark, founder of Smart Patient, a healthcare analytics company. And he should know, because up until 2007, Clark was in charge of Press-Ganey's Patient Satisfaction Improvement Group. The response rates, he says, are now too low to produce reliable results. Insiders have known this for a decade. This is a dirty little secret in our industry, a senior Gallup executive wrote in a 2002 letter to the CMS chief. At those levels, the standard rules of probability don't exist. This means you may or may not be tracking real patient attitudes. Well, the Centers for Medicare Services declined several requests to comment on the record, yet Press Ganey says response rates are high enough to provide scientifically valid results. Well, I guess they would say this, since this is how they are getting paid. So what's the answer? Well, how about if all of us, both patients and providers, behave like responsible, respectable human beings? Doctors, take the time necessary to really evaluate the patient. Look at them in the eyes when you speak. Take care of each person as if it were your most beloved mother, dad, wife, husband, or child. Forget about the money. When you do the right thing for people, the money will follow. And as patients, let's become educated and not take the first pill thrown at us as we walk out the door, having no clue what we are about to ingest. And how about seeking safer alternative healing modalities and not run to the ER every moment begging for drugs? As my dad used to say when someone would call the house on the phone during dinner and it was the wrong number, wipe your eyes and dial again. In other words, let's wipe our eyes and get out of this foggy area of pretending that we're concerned about the patient by asking survey questions that really don't answer anything but rather line the pockets of big medicine while drugging society and feeding big pharmaceutical. And dial again, and this time getting the correct number. And that is simply caring for another human being, another life, with no ulterior purpose. As in the Hippocratic Corpus, I will follow that system of regimen which, according to my ability and judgment, I consider for the benefit of my patients, and abstain from whatever is deleterious and mischievous. I will give no deadly medicine to anyone if asked, nor suggest any such counsel. Why does the government think they have the answer to this? Why is a physician or a hospital's pay reliant on how happily the patient answers a question after the fact? Let doctors do the job they signed on for. Let them faithfully follow the oath. I say, if the powers that be are more concerned with unreliable answers to a bunch of survey questions, to a mess of statistical foolishness, then get another job and get out of the way. And with that, let's hear some legal news you can use. You've heard me talk about my attorney friends at Schraff & King, and I know many of you have taken my advice and contacted them to help you with your advance directives. Things like a healthcare power of attorney, living will, help with information about the Do Not Resuscitate form, and more. But today I want to share with you something that really underscores just why I suggest that you work with the folks at Schraff & King and why they are on this program. Schraff & King are one of only a few practices within the state of Ohio that actually have a certified elder law attorney within their group. Attorneys certified in elder law offer you something that other attorneys do not. So don't go anywhere else. Contact the folks at Schraff & King today. 440-585-1600. That's 440-585-1600. Or visit them online at schraffking.com. And be sure to let them know that you heard about them here on Speak Up and Stay Alive. Again, it's 440-585-1600. 440-585-1600. Call them today.
Tired of the same old presentations?
Can you forward to slide 38, please?
Are you looking for a new, out-of-the-box topic for your next event? Want your group to leave inspired, informed, and satisfied? No PowerPoint presentations and dim lights here. No snoring or snoozing goes on during Pat's presentations. To help your entire group, organization, business, or church stay safe during any healthcare or hospital experience, invite Pat to speak. Pick a topic from her website or request your own. Visit her website, speakupandstayalive.com, or call Pat to discuss how she can make your next event fun, enlightening, and life-saving. Want testimonials? Go to the bulletin board link at the website for color pictures and comments from real people. Again, it's speakupandstayalive.com or call 440-725-5462. That's 440-725-5462.
Does your doctor shake your hand when he or she enters your exam or hospital room? Ooh, where has that hand been? Did you know that healthcare-acquired infections are one of the leading causes of death? Well, now you do, and you'll learn more when you join me, Pat Rulo, and listen to Speak Up and Stay Alive Patient Safety Radio every Saturday morning. For more information, visit speakupandstayalive.com. That's speakupandstayalive.com. You are listening to Speak Up and Stay Alive, Patient Safety Radio, and I am your hostess, Pat Rulo. And today I have a friend, a fellow radio host, and a healthcare advocate who shares my passion for patient safety. He is Dr. Len Brancewicz, a registered pharmacist, certified clinical nutritionist, a doctor of naturopathic medicine, and a homeopath. Dr. Len has over 35 years' experience, and he knows how to keep you safe, healthy, and happy. And he can also be heard every single day at noon Eastern Time at blogtalkradio.com. And his show is called The Daily Dose with Dr. Len, where he delves into current issues. And I just love talking with him, so any chance I get, I want him on our show. So welcome to the show, Dr. Len.
Oh, Pat, thank you so much. And I just have to say, just before we went on the air just now, your enthusiasm is amazing because you've been an inspiration to me. And the longer I have been in affiliation with you and listening to what you do and listening to your show, the more excited I get because I unfortunately get these patients that are on their final legs oftentimes. You know, I've been through the healthcare system and I ran into problems, and then I try to pick up the pieces. I like the fact that what you teach is if you become prepared, you can keep your health. I think that's an inspiration to me on the front side, which I love.
Oh, I appreciate that. Thank you. Thank you. I'll tell our listeners before we got on the air, I was so excited. I took in a great amount of breath and started coughing. So if my intro was a little shaky, I was still surviving my enthusiastic cough. So we'll go with that. Yes. Well, anyway, you and I had a conversation last week about healthcare reform, Obamacare, if you will, and a recent article that appeared in JAMA that studied the survival rates in trauma patients, and it showed that more people are dying, an unexpected finding that suggests that simply providing insurance incentives and subsidies may not improve survival for trauma patients. Talk us through that one.
First of all, I have to say, in the past, people have criticized me saying, you come down so hard on our current medical system, and this is before Obamacare, saying, you know, you become this advocate out here saying that we don't need doctors. And I says, no, let's get that straight. My wife's in the medical field. I was trained in my pharmacy background in the medical field. I know what we have. And here in the United States, we do have probably the best trauma, supposedly, healthcare system in the world. We have a system that can save your life. And we look at all of this and say, well, then what are you criticizing? And I said, it's the fact that we don't do enough on our own to prepare ourselves. We don't do enough to keep ourselves healthy, and we don't do enough to really keep ourselves out of the medical system. That it seems that the more we give people medical coverage, the more we use it. Now, that sounds a little bit off kilter, but understanding that if you do get something, that doesn't mean you have to go running there every time. And I use the analogy on the radio show that so many people become tethered to their doctor. Mm-hmm. Get a sniffle, or even, you know, like I know people, Pat, that if they had a cough like you did, and which we know the reason, you know, we took in a little too much air, but so often we'll have somebody with a small cough, they wake up and they're running to the doctor, and they're using up the medical system, and they're getting and demanding antibiotics or steroids or something that they don't really need. So my passion has been, let's look at that healthcare system. Let's look at the hospitals. Let's pay attention and see what happens. Now, that report in JAMA, and that's what I wanted to talk to you about, and I think this will be a great discussion, said that Obamacare was really fashioned after a plan that had started in Massachusetts. You know, that was the first state that rolled out an Obamacare-type plan where everybody had access to insurance. Mm-hmm. And we wanted to see that if you had that, what would happen. And two amazing things happened in Massachusetts. Number one, the main reason they did that was to pull people out of the emergency rooms and get them into a managed care, get them into a PCP. That was the plan. Get you out of the emergency room, get you into a doctor's office. The complete opposite occurred. Emergency room visits are up almost 40% since the dawn of this. So now with more access, more people are not being directed to a hospital or to a physician. They're going back to the hospital again. What ended up happening because of that is, and this is very recent this year, almost every hospital in Massachusetts is at full capacity. So we are putting more people and admitting more people to the hospital. Now, part 3 of this was, when I go in there, the odds ratio, I'm going in there to be healed, what's my survival rate? And when you looked at this since 2006, and they said your rates of survival have dropped dramatically by almost threefold since the dawn of managed care, that your rates of survival are down almost 15%, 20%. So the odds ratio of you living and coming through that healthcare system have actually gone down. That's a scary fact, and that's the point that we really need to discuss.
Absolutely. I did a segment just talking about annual checkups. Is it a ritual or is it necessary? And science proves it out that it really is unnecessary. If you're feeling healthy and well, then why would you go in? Now, granted, you might find a mole somewhere that you didn't see on your back, but 9 times out of 10, then you're going to be getting all these tests that could give you false positives and create cascading direction into the healthcare system, which we don't need. So it's something to think about, and not just to run, as you say, every time you have a cough.
Exactly.
Yeah, and the Dr. Turner Osler, who wrote this article, he says this, that there are compelling arguments for providing health insurance to all citizens of the United States, but our analysis suggests that simply providing health insurance incentives and subsidies does not improve survival for trauma patients. Ours is thus a cautionary tale for healthcare reformers. Successful healthcare reform for trauma patients will likely require more complex interventions than simply promoting health insurance coverage legislatively. And so there you have it. I think that makes perfect sense.
It does. It does. And, when you, unfortunately, with the cost of healthcare, and that's the part that a lot of people don't really understand, that I have insurance. When I get my prescription filled, I pay $10. Well, somebody else is paying, if that prescription's $200, somebody else is paying for that. I don't think a lot of people have realized that over time. I go into the hospital for this, and I have a $40 copay. Well, the other $300 or $400 was paid by your insurance company, and those costs add up. And as insurances have been given to more and more people, the place they've had to cut back has been in the hospital. Mm-hmm. And one of the things that happens, and you can talk to any trauma nurse, any ER nurse, any hospital nurse, any physician, that their staffing has gone down dramatically. The quality of their, let's say, their sterility has gone down. Mm-hmm. I cannot believe how many people come home with a horrible diarrhea situation called C. diff that seems to propagate. It's coming in with, I believe, 7 out of 10 patients that come in after a surgery procedure come home with this bug they picked up in a hospital. Mm-hmm. And it gets back to all of the things, Pat, that you profess. The simple things, like the little commercial that I run every day on the show for you about Jerry the Germ, and simply watching where you walk and those little sandals that they give you, and how you can easily pick something up that way. Yep. And I love the analogy of the pillow and the fact that you are so big on bringing a pillow that you're going to leave there. Don't bring something home with you. I think that's fabulous.
And you told me a quick story that I'd like for you to share, if you can, about this little 6-month-old that went in for something on his eyes and came out with a secondary infection.
Terrible.
Yeah, tell us that.
This is actually a dear friend of mine. His name's Clint, that listens to the show every day. He inherited a farm. Long story short, he inherited a farm, 400-acre farm from his father, and farmed for a number of years and did very well. And he was in Iowa, and he and his wife felt a calling to go into ministry work. So he actually found himself being pulled closer and closer to Chicago. And when he did, he also had a passion for keeping himself in shape. So he opened a gym, and he started teaching people how to take care of their body. And then he opened another gym. And in the process, he and his wife had 5 children. And recently, their little one, which just turned 6 months of age, they started to see his one eye go a little cross-eyed. So they took him in for a workup, and they found that he had a tumor behind his retina, which is highly unusual in a child this age. So this child had to go in for therapy. And I believe, I don't even want to mention the hospital he went to, but one of the major research hospitals in this country, they went in because a 6-month-old, very, very risky to do this. And they went in for a procedure. he was in the hospital for 3 days. He received his chemo, and I would see pictures of this little child trying to smile going through this. And they finally got a chance to take him home. The minute they did, this little child started crying and screaming and diarrhea and a lot of different problems. So they ended up bringing him back. And they found out that they did then, with a 6-month-old, they did a colonoscopy on this little child.
Oh, my.
Which is unheard of.
Yes.
And they found out that he had a very active case of C. diff, Clostridium difficile, which he picked up in the hospital that could have, even though this child had a tumor in his eye, if this had gone undetected, would have killed this child.
Yep.
And now they had to receive treatment. So the father called me and he said, Len, I need help. They want to treat this little 6-month-old with vancomycin, which is the end-stage antibiotic. We don't have anything stronger.
Yep.
And I said, here's what we're going to do, Clint. And we sent him a very specific probiotic called Saccharomyces boulardii. It can resist destruction by antibiotics, and it can take care of C. diff. So we now have that little child being dosed with a natural prep. I told them how to do it, to open it up. It actually doesn't taste bad to a child, and they open it up, 1 adult capsule, a little bit in the morning, a little in the evening. And I just saw last night, sent me a picture on Facebook, that they said for the first time, and probably since we went all through this, the little child started to smile.
Oh.
So we're now knocking that infection out of him. But astounding to me that we can't take care enough of a 6-month-old that would be on life support going through that serious of a surgical and chemotherapy procedure, that we can't have a place sterile enough that he's not going to come home with a secondary infection. That's just amazing to me.
Absolutely. And we talk about C. diff all of the time, whether it's in our radio shows or live events, because it's something that as a patient or a family member, you can help to thwart by insisting that everybody wash their hands properly. And a little known fact that people even in the hospitals don't realize, the hand sanitizer on the wall does not kill the C. diff bacterium. So if somebody comes in, pumps that gel, and then touches you, and there's any C. diff on that hospital wing or floor or area, it's not eradicating that bug. So if people don't wash their hands, which apparently is what happened here with this little child, yeah, I mean, you are putting your life at risk. And so it's not weird or rude to ask everyone, please wash your hands before you touch me, or else don't touch me.
That's right. And the amazing statistic that I just saw recently is that C. diff has now been found to live on inanimate objects for up to 3 days.
Absolutely.
That's unheard of.
Yep. It lives for long periods of time. I spoke with a microbiologist at one point in time, and he indicated that if the C. diff bacterium feels threatened, it actually can form a hard, crusty shell around itself and become an airborne spore. So now, you might wipe that surface, but you've got doctors and nurses and staff coming in with clothing, lab coats, whatever, and as they're walking down the hallway, if there is one of those dried spores on there, then it can blow into any room. So let's just assume that the C. diff bacterium is everywhere, and to do what you can to make sure and be vigilant that people wash their hands.
Absolutely. And that's why I make a big point of, number one, if I have a friend, a colleague, a patient that's going in for any surgical procedure, they need a joint replacement or they're going in for an injection in their knee, I make sure that a week prior they start on that Saccharomyces, that SBC, that's what I abbreviated, it's a lot easier to say, SBC probiotic, 1 a day, and start on it, stay with it a week before you go into the hospital. Take it while you're in the hospital, and take it for at least 2 weeks after you're out. And you can increase your odds of survival dramatically with something simple as a probiotic. And that to me, you can say it's almost a no-brainer, but it is one of those things that is really so overlooked by most people.
Let's clear up this myth, since you know the answer to this, I'm sure. So it is safe to take an probiotic at the same time you're taking an antibiotic. It won't lessen the effects of the antibiotic.
No, in a certain way, when you can really look at it, it actually will increase the effectiveness of the antibiotic by up to 10%. Now, that's not a lot, but it maintains your normal flora. So when you take a probiotic, you have to use the analogy. It's like planting a new yard. You just build a house, and the landscapers come. You've got all this clay in your front yard, and you have to first till the soil, and then you put in some topsoil, and you sprinkle the seed on there. Cover it with some straw and water your yard. Well, if it rains, some of that may get washed away. And the analogy of the antibiotic is, if we have a major storm come through, it can wash away the straw, the topsoil, and the seed, and you are left back with that clay surface. Well, that can happen inside of us. And when you have a clay surface like that, what happens in our yard? Mm-hmm. First thing that grows, you can't grow grass, dandelions pop up. Weeds grow because they can grow in that hard clay. Same thing will happen with us. If you don't have enough of the good, which is going to adhere and hold the side linings of your whole digestive tract in place, the antibiotic can wipe it all out. You have that barren situation where bad stuff can then start to grow, and that's where C. diff, like a dandelion, will take place and go in there and start to propagate. I think one of the best analogies I've ever heard about why probiotics are so powerful.
Excellent, excellent. And I also want to look to the etymology of the word anti, which means against. Bios is a Greek word that means life. So an antibiotic is against life. Pro means for. So a probiotic is for life. So if people think about your analogy and just what the words mean, I think it's fairly clear that this is really important for everyone to take, even if we're healthy. Talk about that. If I'm feeling great right now, should I be taking a probiotic?
Absolutely. I make that a foundation with every patient I work with. If I could say that there's one thing that can work to affect and maintain your immune system, your ability to absorb your nutrients, to keep your weight correct. You know, we have a whole country that's becoming obese.
Yes.
And a lot of that problem is we run to the drugstore, we run to the doctor. It's the first time we get a little bit of extra burping or bloating, and they put us on Prilosec OTC or Nexium or the purple pill, and that becomes our panacea for the rest of our life.
Yeah. We
stop digesting our food properly, and the body doesn't know what to do with it. We start to gain weight. So oftentimes when you keep one simple, good bacteria presence in your system every day, it's just like planting that seed so that you keep your GI system completely intact. It's the number one source. 80% of your immune system, your own God-given white blood cells, are activated in the gut. And if we don't protect the gut, we're going to run into secondary infections or other problems or sinusitis or allergies, or you can just go down the list. So as a starting point for everybody, I like to propagate a dairy-free probiotic. The bulk of probiotics when they first hit the market not long ago were actually canine-derived. They actually were derived from a dog.
Whoa.
I don't want that.
No.
Most of the products that you'll find in the mass marketers or sitting on the shelf are actually canine-derived. We needed human-derived, and the research came out of Denmark probably 5 years ago that actually were able to colonize and isolate what is exactly the good strains that grow inside of us every day. It's from the time you're born till the time you die. And if we were able to do that in a sterile environment, grow them on agar, not on dairy. You know, the whole concept of yogurt has some probiotics in it. Well, what we found was when you have those dairy-derived probiotics, people started to develop dairy allergies.
Yes.
So when we went to dairy-free probiotics, we actually lower the allergy risk, and we actually promote good health. And it's a simple once a day for any age. If you could sprinkle one of these on your newborn's tongue, I start that young. I start at 2 months of age, and I keep that dose intact for everybody up to the day you die.
Okay, so everybody should be taking a dairy-free probiotic, and then if we're heading off to the hospital or for surgery, then do you switch that out for the SBC probiotic? Okay.
Yeah. The SBC has been put aside for fungal infections, very effective there. Women who would have a secondary vaginal yeast infection, very effective there. People who, because of antibiotics, may get thrush.
Yes.
You know, an overgrowth of bad bacteria in your mouth, is very effective there. So that one in particular can resist antibiotics. The regular probiotics will be wiped out by antibiotics. So whenever somebody's on an antibiotic or has to take one, or some of these children that unfortunately are taking an antibiotic for acne.
Yes.
They need to be on an SBC all the time, or that antibiotic's going to wreak havoc in their system.
Absolutely. All right. Now, you offer these through your website. It's thenutritionshop.net, is it?
.net, correct. The Nutrition Shop. There's 2 P's and an E at the end. TheNutritionShop.net. We have all the products that I always talk about on the show. These ones that I've had up close and personal help in trying to design, those are the products that I like, the ones that I've used. And I mean, I become very critical of myself. And if I find something that is not cutting it, not doing the job, we've scrapped things many times over the years till we get where we're really comfortable that this is the highest quality. And I have to say that I really strive to make it the most affordable. You know, it doesn't have to be that the really good things have to cost a fortune. So we've always had to keep that in mind for our patients and clients, that I wanted to keep it affordable, that we were able to say, don't go running to those box stores. Let's get something that really, really works and that you can tolerate and that it's going to be affordable so that it doesn't break the budget.
Okay. The Nutrition Shop with 2 P's, thenutritionshop.net, and
Correct.
then go under your products page and look for the probiotics. And the dairy-free is the one everyone should be taking. But if someone's in a high-stress situation, then they want the SBC.
Correct.
And I'm sure if anyone has questions, then they can obviously call you or contact you. So share your contact information with us.
Sure. We have a toll-free number set up that answers 24 hours a day. It's 866-461-4536. 866-461-4536.
Give that again, 866-461-4536. And I think this is a very important conversation. Everyone really needs to take heed because as we've just cycled through all of this, we're saying more people are getting secondary infections in the hospital. And so what can you do to protect yourself? Well, this is a great first-line defense.
Outstanding.
Probiotics.
Really is.
Yep. Is there anything else that pertains to this topic that you wanted to talk about today?
Okay. You had mentioned about the crusty shell that some of the C. diff makes, and that we're now finding out that this is happening. Well, that research came out of dental research. You know, dentists have been on the cutting edge of bacteria studies for a long time. They've been trying to investigate for years why, if before we go to bed, we floss, we scrape our tongue, we use Listerine, we brush our teeth, whatever. I use every single thing. My mouth is as clean as can be before I go to bed. And then when I wake up in the morning, it still tastes bad again because the bacteria come back. Well, they found out that there is a specific strain of bacteria in the mouth, a good strain, that keeps the bad strain down. The good strain, I love the name of this, is Lactobacillus salivarius, like in your saliva. It actually lives in your saliva. And they find out that when we do an overkill using alcohol-based mouth rinses, etc., we actually wipe out the good, which lets the bad come back. So they found out that biofilms are a real situation that happens in the body. So in response to that, one of the things I'm working on right now is a lozenge, an actual lozenge of Lactobacillus salivarius. It was just isolated, that for people that have dry mouth or recurrent infections, receding gums, bad breath, go all the way down the line where, you know, cleanliness in the mouth and having good bacteria, we now have a way in a lozenge, an oral lozenge. We're going to call it OR2, I believe, just a simple Lactobacillus salivarius lozenge. You can use 1 to 5 a day that can take care of mouth infections, thrush, receding gums, children that get dental caries on a regular basis. We're just putting more good bacteria directly to the tissue in the mouth. That's part of what I love, that I can help to design products like this that can help people, or even people with autoimmune disease where they get severe dry mouth. This is actually going to help get your saliva back. So something new on the cutting edge that we're working on right now.
That's exciting. That's pure genius, a lozenge.
Yeah. How many people are losing their sense of taste? They go in the hospital and they come out with this dry mouth syndrome where their tongue is sticking to the roof of their mouth oftentimes. And this can help dramatically.
Wow, how exciting. It's just always a thrill to talk to you because we're always on the same page, but you've got such cutting edge ideas and solutions. We talk about problems, but you need to also make those solutions available. So let's keep probiotics in our mind, and everyone listening,
Absolutely.
get to the nutritionshop.net. If you have questions, give Len a call at 866-461-4536. Len, it is always a pleasure to have you on the show, and we're going to do more, I know.
And I also, you're going to be on my show, I believe, next week. We'll try to schedule that time in there. And I'm going to have you as a regular on my show because your message, Pat, needs to go out across the country. And any which way we can do that, we're going to do it. Your message is so strong that we could actually, and I know we are saving lives by doing this, and that's what I'm excited about.
Me too. We're a good team.
Absolutely.
Thank you so much, Len.
Pat, as always, love talking to you, and we'll do this again real soon. Thanks.
Absolutely. Thanks.
I'm Jerry the Gerb, here to spread healthcare and hospital safety tips all over the airwaves. Here's our expert, Pat Rouleau.
Hey, Jerry, what are you doing on the hospital floor? Just hanging out, waiting for an innocent patient to get out of bed with bare feet, hoping to hang on and get comfy under the nice warm sheets when they return? Not with my friends, you don't. They know about you and your sneaky ways. They always wear a dedicated to the floor pair of footies or slippers when they get out of bed and never wear them back into bed. They have one set for the floor and one set for the bed. And they sanitize their hands after they remove their socks or footies. My friends know how easily cross-contamination happens, and they know that germs like you can live on fabric for long periods of time. Too bad, Jerry. No more free rides for you. For more safety tips like this, visit speakupandstayalive.com.
Stay safe. Listen to Speak Up and Stay Alive Radio. For more information, go to speakupandstayalive.com.
Listen to Pat Rouleau and Speak Up and Stay Alive Radio. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com.
You're listening to Speak Up and Stay Alive, Patient Safety Radio. Listen to us live, online, from anywhere in the world at the station's websites. I am your hostess, Pat Rouleau. So happy to spend this hour with you to help you survive any healthcare or hospital encounter.
It's time for our favorite program, right?
What's that?
Fear the Wheelchair.
Oh my gosh, Joe's always so excited to play. By now, you've heard me talk about how I fear the wheelchairs that grace the front doors of almost every hospital. Patients and visitors get out of their cars and hop into the wheelchair, and I always wonder, where have they been? What have they touched? Then they wheel around the hospital and use the bathroom, sit in waiting rooms, visit patients, all the while picking up additional and deadly hospital bacteria like MRSA, C. diff, a bit of E. coli, and perhaps some candida yeast. And at the end of the day, they're back in their car, leaving the contaminated wheelchair at the front door of the hospital, ready for the next patient to climb aboard. This makes the wheelchair a high-touch, highly contaminated vehicle, capable of spreading infections all over the place. So the wheelchair is now this show's representation of all hospital dangers, kind of like our mascot. So here we go with our new favorite. Well, it's not new anymore, but it's our favorite game.
Yes, it is.
It is. And what is it, Joe?
Fear the Wheelchair.
Well, let's listen as Joe reads some right or wrong statements. And then, even though I can't hear you, shout out your answer along with Bob. Is the statement right or is it wrong? All right, Joe.
All right, here we go. Right or wrong? Here's a restroomology question. Bathroom stalls on the right side are cleaner than the stalls located on the left.
What do you think about that, Bob?
Think about it. Maybe it's right.
Oh, no, that is wrong. Bob, most people are right-handed and tend to gravitate to the right-handed stalls. So if you enter a restroom and that has stalls on the left and the right, which one are you going to choose?
Left.
Yes, that's important stuff, Bob.
Right or wrong? If you're going to the hospital for any type of surgery, ask to be tested for MRSA.
What do you think, Bobby?
That is definitely right.
Yes, that is right. Anyone who is considered an at-risk patient should request a nasal MRSA screening.
Right or wrong? When researching symptoms on the internet, believe everything you read. If it's in writing, then it must be true.
What do you think, Bob?
Well, that's wrong.
Yes, that's obviously wrong. But you know what? You'd be surprised how many folks tend to think that way. Research several different sites, check to see who's funding the site, make sure they're simply not in the business to sell wonder drugs or overnight cures. The bottom line, be a detective. Uncover every source that you can, compare and check with your healthcare provider.
All right, right or wrong? If you don't see any bleach wipes in your hospital room, just dust your bed tray with a napkin or paper towel.
Oh, what do you think, Bob?
That's definitely wrong.
Of course that's wrong. Ask the hospital staff for a canister of bleach wipes, put on a pair of gloves, and clean every high-touch item in your room using one bleach wipe per surface. I do this several times each day just as a precaution.
Right or wrong, 40% of tray tables on the airplanes are contaminated with MRSA.
What do you think, Bob?
That's a little high. Maybe that's wrong.
Ooh, sadly, that statement is right. Here's what I do whenever I fly. I bring a baggie of bleach wipes and I wipe down the seat and the seat belt and the tray tapes. With turnaround times as fast as they are, nothing is cleaned, let alone sanitized. And what's interesting is the person sitting next to me or across from me always asks to borrow some of my wipes.
Oh, bring hand sanitizer.
You think I should bring that as well? Do you remember that time that, well, I guess the cabin pressurized my bottle of hand sanitizer, and when I opened the lid, the gel squirted all over the pants on the guy next to me.
It was sort of embarrassing.
It was crazy. Any more, Joe?
Yeah, the last one. Right or wrong, only wealthy people should pursue any kind of estate planning.
How about that, Bob?
Oh, that's wrong.
Yes, that is very wrong. And I challenge everyone listening today to get their financial and health care affairs in order. Power of attorney, living wills, last wills and testaments. You'll be glad you did. Well, remember, the more you know, the safer you'll be. And you heard about it here on Speak Up and Stay Alive Radio. Well, thanks, guys, once again for playing everybody's favorite game,
Fear the Wheelchair.
You are listening to Speak Up and Stay Alive Radio. I am Pat Rouleau, where the boys and I are keeping you safe during any healthcare or hospital encounter. You're listening to Speak Up and Stay Alive, Patient Safety Radio, and I am your hostess, Pat Rouleau, author of the book, Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide, recommended by the U.S. Army's Medical Department on their reading list. And it should be on your reading list, too. That is, if you'd like to stay safe during any healthcare or hospital encounter. It's easy to read, covers over 17 different hospital hazards with special chapters just for women, veterans, children, seniors. If you don't have a copy, you really must order one today. Just visit speakupandstayalive.com or call me and order by phone. Lots of folks order the book that way, so call me 440-725-5462. That's 440-725-5462. At the top of the program, I mentioned my internet radio station, speakuptalkradio.com. And I also want to remind you of our new station just for the youth in Geauga County, Ohio, called thoseradiokids.com. I encourage you to check it out. We have several excellent singers, a 12-year-old Cleveland sports announcer, a 17-year-old political activist, many interviews, and so much more. And I'd like to share a few of our sponsors with you because they care enough to support our youth and give them a voice through thoseradiokids.com. Salem Media Group, that's where this show airs in Cleveland. You know the stations, WHKW, WHKZ, WHK, and 95.5 The Fish. For news, talk, entertainment, sports, and me. Or to advertise on any of these fine stations, visit WHKWradio.com, and that will lead you to the rest of the stations. Another supporter is Chardon Lakes Golf Club. If you like to golf or are planning an outing this summer, head over to Chardon, 470 South Street. This is a 4-star Golf Digest facility, and it's where Bob plays golf, so you know it's good because Bob is a fantastic golfer. For more information, visit their website, chardonlakesgolfclub.com. And for more fun, don't miss Pioneer Waterland and Dry Fun Park. Wet or dry fun for everyone of all ages. Get an all-day pass or a season pass. Great for group picnics, parties, and pure summer fun. Water slides, miniature golf, batting cages, Grand Prix Super Track. So many attractions for kids and adults on Kyle Road in Chardon. For directions and more information, visit pioneerwaterland.com. And finally, for new and used cars, Chrysler, Dodge, Jeep, Ram, visit my friends at Junction Auto Family. Service and dependability since 1931. conveniently located on Ohio 44 and US 322. That's where I buy my cars, and I have since the 1970s. Honest and friendly people with great deals just for you. As they say at Junction Auto, if you want to pay more, that's your business. If you want to pay less, that's Junction's business. Visit them online at junctionautofamily.com. I do hope you'll do business with these fine folks, or just call them up and tell them that you heard about them on Speak Up and Stay Alive, and thank them for supporting those radio kids. I know they'd love to hear from you. Well, we're running out of time, but remember, if you're looking for a speaker to enlighten and entertain your group, I'm your gal. Call me 440-725-5462, 440-725-5462. And come back next week. My guest is going to talk about empathy and the doctor-patient relationship. Plus, who knows what other goodies I'll unearth by then. Until then, I hope you have a healthy and a happy week, free from patient satisfaction surveys and opioids. I am Pat Rouleau, and I am your guide to safe and successful healthcare and hospital encounters.
Listen to Pat Rouleau and Speak Up and Stay Alive Radio. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com.
I'm Jerry the Germ with a Speak Up and Stay Alive healthcare and hospital safety snippet just for you. Here's our expert, Pat Rouleau.
Hey, Jerry, even though you think you're really cool and invisible, smart hospital patients know that you and your buddies hang out all over the place. What am I talking about? Oh, we know your hiding places. Doctors' lab coats, privacy curtains, the TV remote, bed rails, and even hospital pillows. My friends know not to bring their favorite pillow with them to the hospital and then bring it back home. You'd just love to hitch a ride and get out of the hospital, wouldn't you? Well, if we must bring a pillow, we bring a cheap one and leave it at the hospital as a parting gift. No cross-contamination here. For more hospital safety tips, visit speakupandstayalive.com. So ha ha ha, Jerry, we're not sleeping with the enemy anymore.
Stay safe. Listen to Speak Up and Stay Alive Radio. For more information, go to speakupandstayalive.com.